Hello everybody and welcome to the Tuesday edition of Video Clips, and today we're going to talk about misperceptions, the difference between what people think about health and their own health versus what their habits really show is going on. Before we get into that, I just want to remind everybody that tomorrow night on the 19th is our next Ask the Expert panel. We have Dr. Inga Jolly, and joining her will be Dr. Janice Stanger. She's the author of The Perfect Formula Diet and also of favorite wellness forum speaker both on our conference calls and at our conferences, and Chris Dorka, who's a certified personal trainer. And so these people will be having a discussion about health, and then you can ask questions. So if you're interested in participating in that, just call our office and make a reservation. Okay, so let's get started here. For years, I have been encouraging doctors and other healthcare professionals to eat well and to exercise and to look healthy. I think modeling good behavior is important for establishing credibility, remaining in integrity, and to be taken seriously if you're going to give advice to patients about their own health. Unfortunately, it isn't part of the job description, although I think we could argue that it should be. The extent to which doctors are overweight and eat a poor diet is just almost hard to fathom. And so I have some actual data on this I wanted to share with you. The Medscape Family Physician Lifestyle Report 2014 gives us data on the choices that docs are making, how overweight they are, and all this sort of thing. So general surgeons scored the worst. 49% are overweight or obese, but the family practice docs were right behind them at 48%. The ones who were best, dermatologists, lowest rate of overweight and obesity at 25%. Now where it really gets interesting is looking at the diets that these doctors report that they're eating. Only 1% of family practice docs eat a vegan or Ornish-style diet, while 43% eat what was termed a meals-on-the-go diet. Now that was described as fast food, junk food, and vending machine food. Another 43% eat a typical American diet, which was described as, quote, meat most days. Now, while I think all doctors should be talking to their patients about diet, I have to say it might be best if these doctors refrain from sharing their personal dietary habits with patients, because I don't think many of them would get much value out of it. They'd be worse instead of better. The medical profession as a whole doesn't acknowledge much usefulness for supplements, one topic which I think we actually agree on, but 54% of male doctors and 63% of female docs in family practice report that they take supplements. 31% and 38% respectively take a multivitamin, 41% and 29% take vitamin D, and 25% and 23%, men and women, take omega-3 fatty acids. Now, evidence doesn't support any of this, but I guess there's some satisfaction in knowing that many family practice docs use the same bad advice on themselves that they are giving to other people. I don't know. I mean, it's really kind of unfortunate when you think about it. Again, contrary to the profession's public stance on this issue, 46% of male docs and 61% of female docs report that they use complementary and alternative medical practices, most often for pain. Now, it's always been interesting to me, since I've worked on these issues at both the state and federal levels, that medical groups will spend millions of dollars to make sure that it's illegal for complementary and alternative medical practitioners and their practices to be in business, yet significant numbers of their members feel free to use these services regularly. Things are a little bit better for exercise. It's not enough, but 74% of doctors exercise at least 2 times a week. However, only 40% of the obese doctors report exercising regularly at all. Now, I've given you all this data, and it certainly paints a dreadful picture, but when asked, between 80 and 95% of doctors report that they're healthy. So there's obviously a huge disconnect between what these people are doing and then what their weight is and their perception of their health status. So it's no wonder how so many people in the public don't eat well and they're overweight and they're being reassured by doctors that they're okay, because the doctors are looking at their patients and, my gosh, they're just like them. Not surprisingly, only 36% of doctors report that they're happy at work. Now, how can they be happy at work? I mean, they're overweight, they eat terribly, they don't exercise enough, they're out of integrity, their behavior doesn't match their stance on a bunch of issues. Most don't know how to prevent, stop, and reverse disease, so they don't see much health improvement in their patients. I wouldn't want to show up for work for this either. So anyway, just an unfortunate set of circumstances, but it certainly gives us some insight into some of the challenges we face in trying to clean up health in America. I mean, the people who are supposed to be in charge of healthcare are not healthy people, and they don't practice healthy habits. All right, well, while we're on the subject of the disconnect between perception and reality, let's talk about parents and their kids. According to a new meta-analysis, about half of parents with an overweight child think that the child is leaner than he or she actually is. The analysis included 69 studies with over 15,000 kids who were 2 years old or older. And the researchers used tools like pictures and rating assessments and asking parents to report their children's weight status, and then they measured the children's actual body mass index. 51% of parents rated their overweight children as normal or underweight, and those with obese children rated them as either normal, underweight, or just overweight. And it's hard to imagine somebody could actually have an obese child and say that the child is underweight, but that's what the data say. Another meta-analysis looked at 52 studies, including 65,000 normal weight children, and 14% of the parents of these kids reported that their children were underweight. So it's a major problem. I mean, it's normal for parents to think the best of their kids, and that's admirable to a certain extent, but this complete disconnect from reality obviously can interfere with these kids potentially getting the types of interventions that they need to restore their health and to become normal weight. There are a bunch of issues to consider. First of all, some parents may be reluctant to label their children as overweight or obese, thinking that it might stigmatize them or hurt their feelings. But many studies now have shown that overweight children rate their quality of life as being worse than children with cancer undergoing chemotherapy. So I don't think that these kids are being made to feel better or protected by their parents. I think their parents are, I'm sure, inadvertently contributing to things being much worse. Another important issue is how our society currently determines what's normal or perceives normal. Since there are so many overweight and obese people, I think a lot of overweight and obese people look around them and they say, well, I look about like everybody else, so they don't really feel the same type of pressure to do something about themselves than they might have. Like when I was in high school, I think there were 700 and some kids in our graduating class, and only a handful, maybe 4 or 5, were even overweight. I don't remember anybody being obese when I was a kid. So there was a disincentive to allow that to happen to you because the norm was pretty lean when I was a kid. Now, discussions like this usually lead to proposals for schools or government to intervene. We're going to identify kids with high body mass index and intervene. Well, I think the better idea is to have a generalized approach to this whole thing where we try to get everybody to improve the diet and lifestyle habits in the household. I mean, reserving dietary improvement for people who are already overweight and sick misses a great opportunity to get a lot of people who aren't yet overweight and sick to prevent those things from happening by eating optimally. Now, I was fortunate enough to learn about this before I had developed a big weight problem or diabetes or cancer or whatever, but at this point in time, at my age, I'm watching all the people around me and their illnesses, and I just feel, I thank my lucky stars every day that I found out about all this stuff, because I'm sure I'd be getting treatment for something at this juncture had life not intervened and delivered John McDougall's book to my doorstep so that I could learn the real model for health. So anyway, all this to say, the summarizing theme here is that there is a big disconnect between what people do and their weight and health status, and then what they think is actually going on. And at some point in time, we got to reconcile that so that people can make intelligent choices about their health, about their children's health. And my gosh, I don't know what we do about these doctors. I've had a tentative thought in my head to kidnap some of them and feed them rice and vegetables until they see the light, but I guess that's against the law. We can't do that. So anyway, that's all for today. I'll be back to you again on Thursday. As usual, pass this on to anybody who you think would enjoy watching it, and I'll speak with you again later this week.